peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
Our 42nd brief on coronavirus response in the country. Fellow Kenyans, welcome to our daily coronavirus update. Yesterday, we issued specific guidelines on how eateries and restaurants will be reopened. Today, we want to confirm to you that the protocols and management guidelines have since been uploaded on our website, and these can be accessed on www.health.go.ke. We encourage those interested in reopening their facilities to dedicate some time and keenly go through the protocols in order to be familiar with all the requirements before opening. On a related matter, since we first reported our first COVID-19 case, we have recorded many recoveries of our people who have successfully been treated for the disease and who have been able to go home. While we celebrate these recoveries, we are disturbed that reintegration has not been easy for these people. We have reports of stigmatization by members of the community for our recovered cases. And this is unfortunate, considering our constant appeal and massive education to ensure that people are accepted back in the community. Just this morning, fellow Kenyans, we had a briefing with one of our recovered cases from ICU, a gentleman who was able to recover from coronavirus disease. And as he was sharing his story with us, he's given us disturbing events with regard to how he's been accepted back in the community, issues and experiences that have not been pleasant for him and his family. And we need to appeal to you and to remind us all that the only way we can be able to beat this disease is if we avoid issues like stigmatization. Stigmatization will lead to fewer Kenyans accepting to be tested, and it will frustrate the efforts that we are putting on the ground to ensure that we flatten this curve. So we really do appeal for compassion in the community, for understanding, and even for celebrating these people who have been able to go through such a scourge and come out and recover. We do continue to appeal to our brothers and sisters to be considerate, to warmly welcome and embrace our people when discharged from hospital. And to this end, we are taking additional and deliberate steps to partner with patients who have recovered to spread their awareness. We are glad that the number of recoveries keeps rising day by day. And today, we've discharged an additional 5 patients, and this brings to the number of total recoveries 129. Regarding our COVID-19 situation, we continue to see a trend where we have new positive cases recorded primarily in Nairobi and Mombasa counties. While this may be indicative of the disease being domiciled in these 2 counties, it is also a pointer to the immense work that is required in Nairobi and Mombasa. And therefore, as we spotlight Nairobi and Mombasa and ensure that we enhance our interventions there, this is not a license for other counties to celebrate and to drop their guard. Rather, it is a call to action for the rest of the country to enhance the containment measures and to ensure that the virus is kept at bay and the curve is flattened. In the last 24 hours, we have tested a total of 508 samples from 14 counties. Out of this number, 10 tested positive for coronavirus, and of these, 9 are from Mombasa and 1 from Nairobi. This brings to total 384 total number of positive cases in the country. From the number tested, 284 samples were from Nairobi, while 89 were from Mombasa. All the 9 cases in Mombasa were picked from the community by our disease surveillance teams. And it is important that I emphasize at this point that indeed, from the data that we are synthesizing, We are noting that in the beginning of this scourge, we had most of the cases being imported cases, but right now, the tables have turned and most of our cases are coming from local transmission within our communities. And so our containment measures are quite crucial at this point. Each of the following areas has had one case: Old Town, Santana, Miritini, Bamburi, Mikandani, Kibokoni, Ganjoni, Memon, and Chuda. The Nairobi case is from Kawangware. As government, we have continued to partner with Mombasa County on containment measures to curtail the spread of infection, and we are organizing for additional and enhanced surveillance and management support for Mombasa County. We are also urging Mombasa County residents to rededicate themselves in this fight and support the county government of Mombasa and national government in helping to contain this virus. With regard to age distribution, today's 10 cases are aged between 12 and 63 years, and in terms of gender, 6 are male and 4 are female. We have also shared with you the current distribution of cases by county of detection and isolation, and this will be availed to you. It's important to note and maintain that Nairobi and Mombasa maintain lead with the highest number of isolated cases. We do thank you all Kenyans for your continued commitment in this fight, but we also would like to remind you to remember to be compassionate and to be your brother's keeper. Together, we will be able to beat this virus. And again, fellow Kenyans, the matter of stigma could actually take us behind if we don't work together and remember that we are our brother's keeper. At this juncture, I'd like to invite Waziri Wamalwa to give updates on county preparedness. Karibu, Waziri.
Thank you very much, ladies and gentlemen. And I'm here today on behalf of the Ministry of Devolution and Ourselves and the State Department of Special Programs to appreciate the good work that our colleagues at the Ministry of Health are doing on behalf of national government, and particularly with regard to collaborating and cooperating with the counties. We've been working very, very closely, both levels of government, to deal with these situations, and indeed they have done a wonderful job. Today, I've come to engage them further to see how we can strengthen this collaboration, how we can also increase support to the counties, particularly those that are most affected. I'm very happy that from our meeting today, a lot is being done towards this direction of increasing support. And I was happy to learn today that more support is being given to Mombasa. As you have heard from the cases reported, Mombasa is a hotspot. And indeed, from the cases reported today, the highest cases have come from there. But a lot of support is being lent to Mombasa in terms of PPEs that already have been dispatched, and I'm very happy to note that support. We also want to say that though we have the COVID situation in the country, and we are dealing with it, it's not a local issue, it's a global issue. We also are in the same breath dealing with another disaster of floods. In the midst of COVID crisis, the floods are back with us. As you remember last year, we started with drought at the earlier part of the year. Then we had floods beginning September going into October. Towards the end of the year, we had locusts. Indeed, our nation is a resilient nation, but our resilience has been tested over the last 1 year. So today, as we speak, we have several counties that have been affected by floods due to the heavy rains that are ongoing. They have suffered landslides. You heard about West Pokot, Elgeyo Marakwet, Kipkelion, and other areas that have suffered landslides. As a ministry in charge of special programs, we have put measures in place to ensure we give support to all families affected. As of today, we have been able to dispatch over 40,000 bags of rice and other food and non-food items to over 24 counties affected by floods. What we are urging that the families affected need our support. And even as we give them humanitarian support, we want to urge the counties to comply with the guidelines given by the Ministry of Health in terms of social distancing. It might be a challenge where we have families displaced gathered in schools, but we must still utilize the schools that are yet to be opened to create enough space and distancing to ensure that we do not, in the process of supporting or lending humanitarian support to families displaced by floods, also expose them to the coronavirus. We want to ensure that also, as we distribute food, we are able to heed the guidelines given by the Ministry of Health. The protocols on food distribution have already been shared with the counties. And mine today is to urge the counties to heed those protocols. Even as we bring food to them, we want this food distributed through the county emergency teams, co-chaired by the governors and the county commissioners. We urge all leaders, including other politicians, to please work with the emergency response teams to follow the protocols even when distributing this food. As of today, the counties that I've said are affected are up to 29. And those that have lost lives, as we speak today, we have had over 116 lives lost to floods. We have also had over 100,000 households displaced. So we are urging that this humanitarian crisis that we are facing, even as we face it, let us work with the Ministry of Health and all the guidelines that have been given. So we want to thank you very much, Daktari, and urge that I think the country is happy with the updates, with the briefs that we have been receiving, but the counties are also urging that we would like to see you and CS Kagwe coming down to the counties to actually get to the ground and see the state of preparedness in each county. And on behalf of the counties, we'll be very, very happy to accompany you so that we get down to the ground, see the situation as it is in different counties and the state of preparedness, so that we see how to deepen and to widen the support and cooperation and collaboration between the two levels of government so that we can cushion Kenyans against this COVID-19 and pandemic, as well as the floods and the locusts and all that are facing us today as a country. So let me thank you once more and urge you to come to the counties. Asante.
Yes. Tumesikia huo mwito na tutakuja. Thank you.
Yes.
Now over to questions.
My name is Purity Museo from KBC. CAS, Dr. Mercy, I would like to find out on the challenges that the government is facing, because you've been talking about rolling out mass testing, and that has not, you're still doing the target testing thus far, and from what you can see from other nations, mass testing is really helping in knowing how many people are sick, and then they could consider reopening the economy or slowly easing those lockdown restrictions. And then the other point, the other question goes to the CS for devolution. Sir, probably as the CS, apart from the people who've been affected by floods, status of preparedness in counties on COVID-19, would you say that probably Kenyans do not require any kind of aid, because most people have been asking for support, especially on food and other basic needs?
Out of the 159 cases that have recovered, do you have patients that already had existing conditions, and how many of these? Number two, CS Omando has talked about Mombasa getting additional support. Maybe what kind of support are we looking at?
Great. Thank you. So I'll start with the first question from NTV with regard to the case in Kawangware. Indeed, the idea is that, yes, Kawangware now is an area that's under surveillance for us, especially after this first case, but also an area that is under surveillance for us because we have actually been monitoring with regards to adherence of the containment measures. And we've identified markets as one of the possible areas of transmission. If we look at the response that has been put in place by our different supermarkets, you can see that there's strict adherence to masking, there's strict adherence to use of sanitizers where necessary, and there's also adherence in terms of social distancing. I myself was actually touring the market this weekend, and I was able to see that in the marketplaces, some of these measures are not being adhered to. And so going forward, what we're doing is that we're going to deploy more surveillance teams. You'll be seeing all the different markets which have been marked as possible hotspots, having increased surveillance, having increased measures in terms of fumigation. We have a team that has come together with a schedule of how that will look like, but also coming up with innovative ways of how Mama Mboga can still continue with her trade, but ensure that social distance is facilitated. And I think this is an issue that we'll be able to elaborate on further. We do now have the call to be on the ground and to do those spot checks, and you'll be seeing most of us there trying to interact with the public and even have lessons as to how you can correctly put on a mask. Like I said, during the weekend over at Kawangware itself, I could notice people had masks, but they were on their chins. So these are some of the measures that we're going to be putting in place. With regard to Purity's question on challenges that we are facing, indeed, we've told you in past press briefings, there are challenges in trying to run a successful turn of a test. The tests that we are currently conducting are known as molecular tests, PCR tests. And for you to be able to do a PCR, after taking the sample, you have to run it through certain steps and mechanisms to be able to get your end result. Because of the global shortage, every time we get the kits, for example, you've seen we've gotten kits from Jack Ma, and even the Ministry of Health has procured kits. Every time we get the kits have certain components that come together to be able to do a successful run. And the greatest challenge that we are facing right now has been with the supply of nasopharyngeal swabs. We have had a series of interventions and meetings with different players to see how can we domesticate that swab to be able to ensure that it's actually utilized properly to correct the sample and to run a successful test. It's important to note, in terms of capacities, the country does have capacity to run tests. We can and components.
Mimi naitwa Elio Dibio. Mimi ndio mwenyekiti wa Kamukunji Jua Kali Association. Nataka kusema kwamba hii ugonjwa wa coronavirus ni ugonjwa ambao uko na unashika kila mtu ambaye anaweza kuwa in contact na mtu mwingine ambaye ako nao ama amegusa kitu ambacho kimeguswa na mtu ambaye ako nayo.
Let us wash our hands. Let us keep the social distance given at least 1 meter away from one another. Let us avoid all gatherings, unnecessary gatherings. People believe that sanitizer is the main thing to fight the scourge. Let us just use the soap we have at home, even the bar soaps. So long as we maintain the cleanliness that is required, we are going to fight this.
Ili tupambane na hii ugonjwa ni lazima unawe. Hiyo ndio sababu kama sekta tumeweka hizi mtungi kila mahali ya kunawisa mkono. Na tena tunasema ya kwamba ukiwa unafanya kazi hapa, ama wewe ni customer, ama wewe ni mpita njia, ukikuja lazima unawe. Hiyo ndio kusaidia na ndio kukinga hii ugonjwa.
Hii mitungi ya kunawia mikono, mebasi wetu walichukua jukumu, wanatengeneza hizi mitungi na wanauza kwa bei nafuu, kwa sababu wanapotengeneza hii mitungi sio biashara tu ama pesa tunatafuta. Tunatafuta kwamba hii mitungi iweze kufikia mtu, kila mtu, ndio watu waweze kunawa mikono na waweze kujikinga na hii ugonjwa. Si serikali ambayo inaweza kutusaidia peke yake, ni sisi wenyewe pia tusaidiane kwa kufuatilia ile mambo ambayo tunaambiwa na serikali.
For more information, please dial 719 or *719#. You'll get help immediately from the relevant authorities, particularly from the Ministry of Health.
Pamoja tukomeze corona.
Nyumba from the Ministry of Health and working under National Public Health Labs. Today we are visiting the quarantine sites within Nairobi, and the teams are being dispatched out to go and visit the sites. We have the forms which we are going to use to capture the information of the visitors who came from in the country. And we also have the sample collection apparatus, which we have the oropharyngeal swabs and the nasal swabs. And each person is supposed to be taken the 2 samples, the nasal swab and the oropharyngeal swab. We have our PPEs to protect ourselves. We have the safety gears where we are having this, and the disinfection for disinfecting the apparatus which we are going to use. The waste, we have the biohazard bags where we are going to put all the waste which is generated within the site where we are collecting the specimen. We have the biohazard bags to safeguard the environment. And with us, we have the transport media, because we have to make sure that the samples which we are going to carry, they are if the virus is there, they are viable. So we have the transport media which we are carrying with us, and we are maintaining the cold chain, because we have the cool box which is equipped with the ice packs to maintain the cold chain of the virus of the samples as we come back. To my fellow Kenyans, I have a word for you today. Kindly stay at home. I am at work to safeguard the environment and to safeguard ourselves. The corona is real. It is real with us. So please let us stay at home as the health workers continue working and supporting the government or the guidelines which they have been put on place.
To my fellow African diaspora, a very good day to all of you. My name is Ambassador Arikana Chihombori Kwao. Over the past couple of days, I've received many messages, emails, phone calls, and video clippings of the abuse that is being meted to our fellow African diaspora living in China. I've watched in horror Africans roaming the streets of China with their possessions after being evicted out of their homes simply because they're Africans. I've watched in horror Africans roaming the streets with their suitcases and at times with nothing at all, roaming the streets after being thrown out of their hotel rooms simply because they're Africans. I have watched in horror women carrying babies roaming the streets of China with nowhere to go after being thrown out of their homes simply because they're Africans. I've heard many stories of Africans who are married to Chinese being separated from their husbands or wives simply because they were Africans. I've heard stories about Africans being forced to take COVID-19 tests simply because they're Africans. In many cases, these individuals did not meet criteria for testing, or they had been quarantined for the specified time period as mandated by the anti-pandemic laws of China. Not once have I heard any complaints of any African disobeying the anti-pandemic laws of China. Why is it then that Africans are being singled out and mistreated? This situation is not acceptable. It is wrong, and it will not be tolerated. To President Xi, I say, while you have enjoyed good relationships with all the African leaders, it is precisely because of that you should do the right thing. You are sitting in the big boy's chair, and we are asking you to make the big boy decisions. We're counting on you to make sure that the Africans that are roaming the streets and have been evicted from their homes be allowed to go back home. We're also asking you to make sure the Africans who are roaming the streets because they have been thrown out of their hotel rooms be allowed to go back to their hotel rooms. As we speak, President Xi, may I remind you that we have over 10 million Chinese residing in Africa, where we have welcomed them with open arms. We have allowed the Chinese to establish themselves to marry Africans and live happily ever after in our Africa. Why can't Africans be awarded the same welcome that we have given to millions of your citizens? What is being done to Africans in China is deplorable, and the world cannot stand by and allow it to continue. While we understand that the majority of the Chinese are good people, they're good citizens in China as well as in Africa. However, sadly, among them, there are a few bad apples. A few bad apples that have chosen to give China a bad name. A few bad apples that are making China look bad in the eyes of the Africans. This is a situation that cannot be allowed to continue. President Xi, you are a good man. And we would like the relationship between China and the African governments to continue unabated. But the behavior that's coming from a few of your citizens will not be tolerated. And we're counting on you to do what is right, to do what is just, and to do what is fair. The Africans are no longer going to tolerate this abuse. From the Chinese or anybody else for that matter. The African youth are enraged. We're asking, when is enough going to be enough? President Xi, the power is in your hands. We value, as Africans, our relationship with China. Please do not allow a few bad apples within your citizens to ruin what is otherwise a wonderful relationship between China and the African countries. As a united citizens, as a united African citizens in the diaspora, we are asking you, President Xi, to do what is right, to do what is just, and to do what is fair. The children of Africa are saying, enough is enough. The abuse of Africans at home and abroad, be it in China or on the continent, has got to stop. Humanity.
Thank you. Anybody who has been in the military will understand that when at war, in war, with war, you don't court-martial your soldiers or officers while the war is on. You finish the war first and then investigate the officers or soldiers who might have misbehaved or neglected duty. This is the doctrine of the institution of war. Today, Kenya is within the war and at war with an invisible enemy called COVID-19. And we must support the efforts of the frontline officials. Then we put them on trial later if there are mistakes. Remember, the country is at the weakest link now, and we cannot afford to deflect the efforts of those soldiers on the front line of fighting COVID-19. Thank you very much, viewers. That is me. Thank you very much, viewers. This is MATSANGA Africa Perspective. It ends there now. MATSANGA Africa Perspective. Miriam, coming all the way. I can see you are not even well already. I wait for you first, but let me go on. The situation in Africa depends on the curve being flat. Where is the hope? Our hope is in the curve flattening. But the events on the continent, do they give us hope? Yes, they give us hope. Several countries have done their best. Several countries are fighting this disease with all the precautions and with all the energy they have. But there are still some on the continent of Africa that might be a mistake as why Africa is always called a darker continent. We shall always look at those weaknesses, build the strength using those weaknesses. Miriam, the hope that we've looked for is the curve to be flat. And the flat curve will give Africa a new beginning, a renaissance, a rebirth of this continent. So I believe one way or the other, that curve is coming. As you can see from this and the notes that we shall give you, the first confirmed case of coronavirus was reported in Kenya. I am handling this program together with Miriam Oguto, who is in the studio miles away in Nairobi. Good morning.
A very good morning to you.
First, the first confirmed case of coronavirus was reported in Kenya on 13th March. The patient reported to be a female who returned to the country from the United States and passed through several states, including London, on her way to return to Kenya. The tests were confirmed positive by the National Influenza Laboratory. The patient was placed in isolation and the Kenyatta National Hospital. The story of that patient is now history in that she survived the corona, isn't it, Miriam?
Mm-hmm. Yes, indeed.
And she is, yes, and she is with us. Mm-hmm. Okay, that is Kenya. The first coronavirus of infection in Egypt was confirmed on 14th of February. In a Chinese national, when a Chinese national arrived in the country but did not show any symptoms. Egypt, which reported the first coronavirus patient on the continent of Africa. Egypt, which reported the first corona patient in the Africa on February 14th, had seen a rising number, and today it ranks among the first rising numbers on the continent of Africa. Mm-hmm. Miriam, you can take over from there.
Yes, indeed. A very good morning to our viewers there as a doctor is giving us a breakdown. Egypt is the first African country that confirmed the first case here in the continent, and that happened on the February 14th, Valentine's Day to be precise. And since then, we've seen a rise of so many cases of coronavirus there in Egypt. And as it stands right now, I think Egypt is at... is it the first now leading in terms of infections at 5,000? No, South Africa still leads, and then Egypt comes second at 5,268. And remember, the first case there was confirmed on 14th of February in this year. And since then, we've seen the cases rise there. And also... Until now, as we speak, by the 23rd of March, Egypt confirmed the first case on the 14th of February. By the 23rd of March, slightly a month later, the whole of Africa, 43 countries had indeed recorded confirmed cases across the continent. And as it stands right now, only 2 countries in Africa have not confirmed cases, and that is Lesotho and also Comoros Island. And Doctor, as we look at this curve and the hope in Africa, there are a lot of predictions that have been made. World Health Organization has been making predictions and really raising alarm over the cases of Africa and really worrying the rest of the world, even as their cases continue to increase. But they've been so worried about the cases in Africa. And we've seen the coronavirus cases in Africa, they said, according to the World Health Organization, and this is a report that was done on the 17th of April 2020, and they said they could see a surge from just thousands now, because as we speak right now, Africa, still the numbers are not as much. So we could see the surge from thousands now to 10 million within the next 3 to 6 months. So that is what we are being told there, according to provincial modeling. A regional World Health Organization official there has said. So as much as we are here, we are happy that the coronavirus has not really had a surge as the rest of the world was expecting. They are still saying, Doctor, in the next 3 to 6 months, African cases are expected to get to 10 million.
Well, first of all, I don't want to go into the details of the failures of World Health Organization. And as we said during the war, we fight the war first and then come to fight the troops later. And that's why we are holding our petition, and the other people have held it, put it back. Then we shall find time later to come up. We want to give them time to predict even more. You know, after the pandemic is over, there will be an endemic. People have forgotten that is going to happen. If you have forgotten, then you are not yourself. There might be small pockets of disease remaining in countries which will not be on the same level with other countries. Today, as we speak, Austria has opened its schools, its trains, and everything. They're running. So while next neighbor, Germany, is still struggling. So country to country are going to open up their airspace, their business industries, their manufacturing industries, their hotel industries. But East Africa and Africa has a problem in that we are not working uniformly. I was very, very happy yesterday when President Museveni, President Kenyatta, and President Kagame had a discussion. I think you can see the pictures there of President Uhuru Kenyatta having discussion and President Museveni having discussion with other leaders of the East African region to find a solution, a common uniform way of how to deal with COVID-19. Because if we don't find a common position, you will finish COVID-19 in Kenya. But you won't stop Tanzanians from coming to Lunga to have a drink. You want to block them from doing so. You want to block Kenyans going up to across Tanzania to buy some things which are missing in Kenya. Or Kenyans coming, Tanzanians coming to Kenya to buy some things. So these are some of the challenges that we must now go back to the drawing table and find very seriously solutions for. And I was very, very impressed with President Museveni and Uhuru Kenyatta and Kagame and Magufuli, who had discussions on what they can do in order to have a common uniform that will allow the trucks to travel between Kampala, Rwanda, and Mombasa, vice versa, up to home. So these are some of the things that I'm talking about. The hope lies on those. But the World Health Organization is not giving up. It is still bringing a gloomy situation on Africa. They have estimated that 10 million people in Africa will have the disease. So we don't know where this 10 million will come from.
And they're saying yes. And they're saying also that in the worst case scenario with no interventions against the virus, Africa could see 3.3 million deaths and 1.2 billion infections. The report by the UN Economic Commission for Africa's Aid also added that. So we could see 1.2 billion infections. That's like the whole of Africa. And then 3.3 million deaths. If no interventions are put forth, yes.
So but interventions would be, what interventions? We need medicine, which we are not seeing. The medium, I don't know whether you're understanding that the entire pressure that is coming of interventions is to sell the medicine. Clearly, Africans must listen to me. These people want to sell the medicine. All this data is appearing now, preparing us for a medicine, a vaccine, which we might not refuse because we have to scare people first, to tell them that 10 million people will be infected and then come with the medicine and sell. That's okay. If the medicine can heal Africans, it's all right. What can we do? We have been caught up here. I am one of those who said some of these things should have come much earlier so that people can look for what can be done. We waited too long. Miriam. The World Health Organization is giving us these directions, this information. Too late. We are already with the disease, and it is already here. And it has found us at a very difficult situation where we don't have the money, we don't have the food. Yes, some countries don't have the food, no money, no infrastructure, no beds, no ventilators, no masks, no medicine, the worst part of it. No factory in Africa produces for surplus. Show me one factory in Africa that is producing for surplus, like the factories in China. The food we buy, the things we bring from China are surplus because first of all, Chinese themselves consume those things and then they bring something left over and they say carry to Africa. There is no factory in Kenya that produces surplus. Either they will be reduced after coronavirus, they will be reduced to produce on demand or produce on order. You want 200 boxes, I'll produce them tomorrow. These are some of the things that are going to affect us on the continent. But thanks, Miriam, you have come up with this World Health Organization predictions that have come too late when people are already dead. Some people are gone. Over 1,700 people in Africa are gone. Another 34,000 are infected with the disease. My dear sister, these good guidelines at the moment don't help people in Africa. People are already in trouble. People should have told. The only place, by the way, I didn't tell you this morning. Mm-hmm. Sometime last year when the social prime minister came here, mm-hmm. I usually go to Kempinski for my gym and other things, then have a drink and a food. I was seated in one of those restaurants in Kempinski called Luca. A gentleman who has seen me on this television punchline talking and writing, he said he came to me. By then there was no corona. So he said, can I join you? And are you Dr. MATSANGA? I said, yes. He joined my table with another lady from Lesotho. they all work, Lesotho, they all work in the Ministry of Foreign Affairs. And by then, the Prime Minister was here on a 3-day working visit, which he visited President Kenyatta, and they were staying there. So the man said, he remembers me because I wrote a letter about African Union, which does not function. A useless organization that has left us on radio call now. We only radio call each other. But in actual terms, it delayed to even warn us of this catastrophe. So he went, we exchanged the cards. I pulled out my card and I gave him. From last year, he has been following my work. So on 18th of February, when I wrote that piece, warning Africans that this thing is coming, because you have seen the movement of Americans from Wuhan and the international intelligence moving from Wuhan, telling Americans to return home. The government of Lesotho he was a senior, I didn't know he's a very senior person in the Ministry of Foreign Affairs. He went and brought to the attention of the Prime Minister and the Foreign Minister and the government that we better, have you seen this? And have you seen what is happening in China? Miriam, I did not know. That gentleman 2 days ago called me. He said, when the coronavirus is over, we shall arrange you come to Lesotho for an award. I don't know what type of award. I hope it has some smiling eyes, which are usually, you know what it is. They told me, and I've written that this morning at 5 to say, I did not know that that letter was taken seriously by the government of Lesotho. And today, from your list, I think you still see Lesotho is still the only outstanding country without any case, with Comoros. So we have a problem in Africa. Had we got this information much earlier, the chaos that we see now here, people fighting, running, blocking cars, would not have been there. We would have waited, washed our hands much earlier. But we thank the World Health Organization now for giving us this information so that we don't give up telling our people that we have a problem and this problem is coming. Miriam, I am very, very, very impressed with, after criticism, one of the things that you must not ever ignore is criticism. When you are criticized is when you work hard. When I started criticizing Mr. Tedros, is now you can see Mr. Tedros is working. And therefore, in a war, we leave him until the war is over. Then we come for him to ask what went wrong. So that is all I wanted to say today, this morning. If you have anything else, you can continue with reading the rest, Miriam. Over to you. Nigeria, Tunisia, Senegal, Morocco, and Tanzania. I will come in where you feel I should come in to read. Thank you.
Yes, indeed. And Doctor, there you mentioned earlier that the East African community and some leaders met, that is President Museveni and the Rwandese president, I suppose, and just to chat our way forward.
They spoke on virtual meeting.
Virtual meeting, yes. So that is not the first time that happened. So on the 25th of March 2020, ministers responsible for health and the EAC affairs, that is the East African affairs, also met by video conference to share existing knowledge and information on the COVID-19 outbreak, deliberate on the COVID-19 pandemic, map up containment strategies to stem out any further spread of the disease in the region and develop a clear plan to mitigate against impacts caused by a COVID-19 pandemic in the region. And the ministers responsible for the health and ministers responsible for East African Community Affairs, this is what they agreed all together. And I'd like to hear just your thoughts on this, and if at all this has been implemented by the member states of the East African Community. So they all agreed that number one, directed all partner states to continue implementing mandatory quarantine for 14 days for all travelers to the region and avoid imported cases by implementing strict screening procedures at all point borders. We've not seen that really happen very much, especially in a country like Tanzania. And then the second part, resolved, maintained a suspension of EAC regional face-to-face meetings and urged EAC organs and institutions to utilize modern technology such as video conferencing, webinars, and Skype calls for holding such meetings until such a time when the situation has been contained. Well, they've been doing that. And also directed all partner states to implement 100% exit and entry screenings by applying the multi-layer mechanism to avoid some loopholes such as transit passengers, and also directed all partner states to ensure that truck or vehicle carrying goods have only 2 to 3 crew members per vehicle to facilitate smooth border crossing in the region. And also the crew members are in good health. Crew are screened and found to be at high risk or positive of COVID-19. The truck will be contaminated before it decontaminated before it is allowed to continue to its final journey. So we see there a couple of things that the EAC member states there and health ministers had a meeting on the 25th of March last month, and those are just some of the things that they agreed upon so that member states take responsibility on their own parts to ensure a collective responsibility and to defeat the COVID-19 in this region. But what we have seen, especially the first one, implementing mandatory quarantine for 14 days for all travelers to the region and avoid imported cases by implementing strict screening procedures to all borders. We've not seen Tanzania doing this. So is it not part of the East African community while our headquarters are over there?
I think it is. I expected this to have worked so well.
Yes.
But what bothers me right now, if you look at the meeting of yesterday, that is all the presidents are here, Bongo. You can see your friend, favorite man of Egypt, and you can see Kagame. You can see the medicine man.
I see COVID-19, COVID
of Madagascar
yes.
with his medicine on the table. So, and you can see our own president, my good friend, the Pan-African guy, President Uhuru Muigai Kenyatta here with a very nice shirt. These shirts are available. So that is Africa. They were making points. They were discussing the future of Africa. That is very good for me. But whether the implementation will take place is another worry. That is all I can say, Miriam.
But if this was agreed upon by member states and one of the member states is not really adhering to these measures, I think it will just, yes.
If you want to say whether it was agreed on, Miriam, yes, some member states have continued with the 14-day,
yes,
21,
like Uganda
21
and
day.
Kenya, yes.
Yes. And the 3 states are locked down. And even Sudan is also locked down at night. So the cases in Sudan are just beginning. They have just come from the theater. They are growing. They are growing because we have now 34. I don't know how many you have today. They could have gone up. We shall see in the next program. But mine is to laud the government policy. And mine was to read it to you that in war, you don't punish the soldiers even when they have made mistake. 2, countries in Africa are the weakest point. Kenya is one of them, are the weakest link. You don't need to push a person who is already at the weakest link. You wait until he regains, he eats food and gets heavy, then you can talk to him and punish him. Thank you very much.
All right. Thank you so much there, Dr. and of course the crisis here in Africa that has been brought up by the COVID-19 has really jolted African nations into creating a pooled purchasing platform and African Union to improve negotiating power, because right now a lot of countries who have been manufacturing these medical equipments that are required to fight the COVID-19, they have not been agreeing to sell. So African Union has been trying to speak on our behalf, although I've not seen any purchases that the AU has made. And so Africa also has benefited from the UN's largest emergency humanitarian operations in decades, with medical cargo, including hundreds of ventilators that arrived in Ethiopia last month, that were given also by the Chinese, tycoon there, Mr. Jack Ma. So a lot has been happening, but even as these projections have been made about Africans possibly, recording 10 million cases in 3 to 6 months if interventions are not put in place. But we've seen they've been trying to model these figures from the start of this pandemic, but Africa seems to have, taken another turn that has really surprised the world. So what can we encourage now the member states here in the continent, seeing that we have, and the reason why the Western world is really worried about Africa is because of our very poor health system in this continent, and they're saying should these numbers go up, then we'll be very overwhelmed and we shall not be able to take care of those cases. And also a person like Melinda Gates, and we've talked about this earlier on, sometimes back last month, came out and said Africa is one of the things that keeps her and her husband awake at night, because they cannot sleep soon. And very soon we're about to start seeing dead bodies in the African, streets. And I took a bit of offense in that. I know we have our problems, but we're not that bad. I mean, we're trying. Our governments, we have our own problems, but they're doing our level best, even as other issues are now emerging. So what can we advise our African leadership in terms of just continuing in the war against COVID-19?
I think, Medium, what do we advise is continue to spread the message. Let the media spread the message. Let all health officials strictly, those who see suspect should report. Let's stick to the restrictions. Let's stick to the curfews. We shall overcome. Wash our hands, stay a distance, don't move during the curfew, because you might be very healthy. But when you break the curfew, you end up in a quarantine where are people who have COVID-19, and then you have a problem. So stay home, drink from home, eat from home when it is curfew. 2, wash your hands. 3, stay a distance. 4, seek medical treatment. Call the hotline number in your country. There, we shall be all right. These predictions of World Health Organization on Africa might be disproved if we do the following things. They might not happen. But if you don't go by it, it might happen.
All right. And Doctor, there, as they were running those pictures, the photos from the video conference that happened between the different heads of state here in Africa, I noted there President Rajoelina there of Madagascar with his COVID organic, that's what they call it, COVID organic. I don't know, were they able to discuss it there, the heads of state? That I have not seen, the minutes or the content of that meeting that happened yesterday, but is there a chance that they even talked about this COVID organic, but that President Rajoelina seems to have presented to them there? He had it, the bottle was just right beside him there.
Yeah, that is, this guy of Madagascar is a miracle maker. The other time he took over government jokingly and removed the other government official, and then he went. He's a joker. He's a very serious disco joker, a DJ, and he has found some. What are the numbers for Madagascar there?
He's a disc jockey.
Disc joker, not disco, because disc is a horse.
So the confirmed cases, and you know what? You know the COVID organic could be working very well there, because the cases in Madagascar, confirmed cases, is at 128, and recoveries there is 90. So that is encouraging there. Perhaps we should try the COVID organic.
The cases in Madagascar, how many?
128, and the recoveries there is 90, and we've not seen any deaths there. So high rate of recoveries.
There you are. If you minus 128 minus 90, you can get how many patients are under. So we shall all go for that island, man.
So only 38 people are sick in Madagascar.
Yeah, let the planes open. We shall all be on the island until it sinks. Itaenda chini. In the Indian Ocean, people are coming.
But
I'm told the United States of America has bought this.
Yes.
These whole bottles.
They're purchased.
Yes.
Yeah, I'm told they also pumped in some money to support the production of the COVID organic there. But is there any news about the heads of state, discussing it during that meeting as a possible solution here in the continent? Were they willing? Was President Uhuru Kenyatta willing to try this COVID organic? I've not seen the content of that meeting yet.
I think I will investigate that. Then
we need to know. Yes.
On our diplomatic leaks program in the evening at night.
All right.
That I will broadcast tonight. So I will bring that, whether the discussions are bearing any fruits, or I think they must have discussed. And one of the things that must have made President Uhuru Kenyatta laugh is that medicine. Because the picture here shows the president laughing about this, Mr. Angelin. Because they were talking, and that's how the president started laughing about the picture of the bottle in front of him.
And our favorite man there is all seem very pleased with it. I don't know whether it's the COVID-19, the organic, that is not making him very happy. President Al-Sisi there from Egypt, he's a
military man. So he's worried about another. A man is where his people, the numbers are high. So I don't know whether he was saying, can I give you some to try? Some patience.
Because as we know now, Egypt is the second after South Africa. They keep interchanging the positions there. Yesterday it was leading. Today South Africa is back on top as the country with the most infections. Then Egypt comes in just in the second place with a few cases less there. So yeah, I would understand why Mr. Sisi's face would look like that, not very amused or just worried there. And Mr. Solution Man is sitting there with the bottle, very, very happy. He seems quite relaxed, thinking, I have the solution for this continent.
Yes. The guy has the solution. These people have not died.
They should start taking him seriously. I know every time I look at that bottle, myself, I feel like laughing at maybe it's the packaging.
I have always taken this guy serious.
Yes.
Seriously, because he overthrew a government, installed and won an election.
Yes.
He came back. The man who claimed to have been popular arrived back and lost an election. And he has reconciled with him and left him to be there. You see, after being defeated by a ballot. So I take him seriously, as a human being. So Miriam,
yes.
I think over to you, and with your Africa Diaspora News. For me, I want to thank everybody who has been listening to me. You will listen to me again tonight at 8 o'clock with the diplomatic leaks. I will be hooked to Kampala, Uganda, to find out from Mr. Ouma, the journalist who is working on stories from Kampala, and we talk about the subject that the topic will be this afternoon. I think the topic seems to be the same thread that I will talk about a war area and the weaknesses of African states. What can we do? At this point, we are all weak. We don't need to harden people by pushing them to the corner. Let's wait, document the evidence, we shall put them on trial later. Thank you. I thank you very much. I thank you very much. Aso.
All right, thank you there, and thank your viewers, but don't go too far. We'll start another link for the Diaspora Dispatches. Emmanuel Manuel, nice to see you now. Can I see you over the Diaspora Dispatches link there so that we get to talk about Africa and the news making headlines in the continent?